Eileen the fam here. Hold on while I get close. I just have to make sure I hit the right button for a moment. Okay, good. I did. Today we're going to finish our segment on autism. Next week we will go over bipolar disorder, but just to let you know, this is going to be the last segment on the autism that I'm going to cover today. In the first segment, we went over a little information about what autism is. The second one, we discussed some of the signs and symptoms of it and when you can start noticing it in your child. Today, we're going to go about talking about some of the things that we can do to help an autistic child and take it from there. So saying that, let's get started. Since there hasn't yet been any way to prevent autism and where it affects so many people in different ways, there's no exact treatment for it. The treatment is varied from person to person because it's such a wide spectrum. And the reason why there's no prevention for it is because we don't even know the cause yet. They think they know some contributing factors, but none of it has been proven to be exact. So there's no way that you can prevent autism. You could be two perfectly normal people and end up with an autism child, but it doesn't mean anything. Okay? So because of this, like I said, and it's has such a diverse array from mild to severe to somewhere in the middle, each case is different. So they don't have like a set book like you would do for a physical disorder. It's different person by person. So each person has to be treated differently than the last. They cannot go by a set rule. So, knowing this, there are still many ways that it can be treated with family and a team of professionals, which may include a therapist, a physician, and a speech pathologist. Some of the treatment methods may include behavioral training and management through self-help, social skills, thinking, and positive reinforcement. Some other treatments include, of course, medications, community support, speech, occupational, and physical therapy. And before I go any further with that, these are, depending, the reason why they list so many is because the range is so much. So depending on where your child, niece, nephew, grandchild, great-grandchild is that has autism, depending where they are in the spectrum, depends on the type of help they're going to need. But young children with autism should receive 25 hours of therapeutic activities to meet the child's needs per week with highly trained specialists. Now, 25 hours a week, you may say, well, that sounds like a lot of money. I mean, a lot of time. Well, if you break it down, it's not. And your child's worth it. Your child's worth it. Anybody is worth it, no matter whether it's 25 hours a week, 50 hours a week, or 100 hours a week, okay? Now you ask yourself, if they need 25 hours of trained help from the medical field, how am I, as a mother, aunt, uncle, grandmother, grandfather, or friend, or whatever, supposed to help? Well, that's where I'm going to let you know some of the things you can do to help. Now, the first step into helping anybody with autism is education. And that's what I'm trying to do, is educate you a little bit. But please, with this, don't let this be your only education. It needs to go much deeper than this. This is just the tip of the iceberg. What we mean by educate, okay, let's just say it's your child. If it's your child, or any, niece, nephew, grandchildren, or whatever, get involved. There's autism groups out there. Get involved with autism groups. They're great for support. They're great for ideas. Ask questions to the medical team, to the therapist. You don't know unless you ask a question, and believe me, no question is stupid. The only stupid question is a question that's not asked. Okay? So ask questions. You ask questions, you learn. Knowledge is power. And by that, I mean the power to know, so you're more informed. You'll know how to handle things a lot better. You can help more by learning. Okay? So get involved with their care team. Get involved by asking the doctor questions, their therapist, their speech therapist. Like I said, autism groups. You can also get a child involved in hobbies, and by seeking support and promoting health, growth, and development of their self-esteem, weight, confidence, and friendship. Now, before I say anything else, let me remind you, in the last segment on some of the signs and symptoms of it, these are areas where they're going to have problems. So you can't just put them in and expect them to be like everybody else. You can't just pick a hobby and expect them to be interested. This is their problem. Make it interesting for them. Reward them. For instance, small little things. If they like to do puzzles, reward them when they do a puzzle. Reward them every day. Keep note. Watch their actions. When you start seeing them kind of losing interest in it, think of something to make it interesting. Put yourself at their level with what they're going through. Let me give you a little example what I mean. I'll give you just something I've gone through in my life. When I was in school, we had a program called the CETA program, C-E-T-A. And it was like a Job Corps, which is what they have now. In the summer, they gave us a job. Well, my job was in a daycare place, working with preschool children. Now, while I was there, I was noticing the daycare providers there, were treating it just as if it's a job. Now, I've learned, because I had special learning problems when I was in school, where I had to be part of a program called IGE, which stands for Individual Guidance Education. Sometimes that's a lot better. What they were doing is they were giving the preschoolers their work for the day, simple little things like coloring or whatever, reading what they wanted done, and then telling them, okay, do it. And I've noticed by watching that, a lot of the kids would kind of have that look on their face like, I don't know. So I went over there and I showed them kind of how to do it. And I did it not just in the learning, but in the playing. I didn't just go out and watch them play. I participated with them. Children enjoy it more when you participate, when you be part of their experience. So if you want, like, coloring books, if your child wants to color a page with them. Make it fun for them. if it's doing a puzzle for a hobby, do the puzzle with them. They'll have their interested in it a lot more. Remember, support is also very important. So while you're doing this, you're also using the resources of different support groups to help you along. Okay? So remember, everybody deserves love. Everybody needs to be needed. That's the way we were created. Don't put them aside or think they're not worthy of your love or your attention just because of this. Let me tell you something that I've noticed. Most people that have no disability, now I'm not saying this is everybody because it's not, but most people that do not have a mental or physical disability see with these. They see just this. They don't see in here. But if you learn not to see with your eyes, but see with your heart, you'll see more than the outside. You'll see from the inside out. You'll be a much better person, a much loving person. You'll be a lot happier, and the people around you will be a lot happier. This is why my favorite motto is, see with your heart and not your eyes. Because your heart won't lead you wrong. Now, I'm not saying, the heart as far as love. That's a totally different thing. But don't judge somebody by their appearance or if they're not perfect. Because let me tell you something, in God's eyes, we're all perfect. We're all perfect. We're made uniquely special. God knew before we were born what was going to happen. It's like, I'm just telling you my experience. I've grown up with something that they call RP, which is retinitis pigmentosa. And what that is my retinas are slowly deteriorating. Now, I don't want pity. That's not what I'm asking. I'm trying to explain something. So please don't pity me, okay? I've seen people when they see my problems, oh, I feel so bad for you, I'll donate my eyes, or blah, 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 blah. I don't want that. This is not a curse to me. It's a blessing. Me having my being visually challenged has taught me to see from the inside out. It's a gift. And I love my gift. Because I love seeing from the inside out. I see people for what they are in here. Not this, what they wear, the way they walk, or anything like that. I see them for the inside. And that's the way we need to see everybody. If you look over here, where my pointer is, this is why I love this saying. Autism is not a disease. Don't try to cure us. Try to understand us. That's all they want, is understanding and love. And this is awesome too. Autism. A for always. U for unique. T for totally. I for interesting. S for sometimes. And M for mysterious. Always unique, totally interesting, sometimes mysterious. Autism people are just like you and I. Please, I implore you, if you know somebody with any mental illness, any physical problem, treat them like a human being. Show love. Have empathy for them. Be understanding. Don't pity them. Nobody wants pity. A lot of people think that somebody with mental or physical handicap needs pity. We don't need pity. We need understanding and love just like you do. Okay? If I get touchy on this, please forgive me. I've seen so many people hurt. I've seen them shunned away because they're not so-called perfect. And it bothers me because these are human beings. They're not pieces of trash. They're not a used toy. They're people. And they deserve the respect, love, and understanding that you would give anybody else. Okay? So remember, you matter to me because we all matter. You're important. You're uniquely made. You're not alone. And I love you for you. So until tomorrow, bye. Love you.